this panel that is coming up right now, we know that many people are going to be excited about, and the panelists who are here to speak with you are truly, truly some of the best. I'm just going to present the panel moderator, who is Rebecca Gordon. Rebecca is a senior program advisor with Together for Girls, and she's going to talk to you more about what Together for Girls is. But Together for Girls is a groundbreaking, extremely important initiative. It's a public-private partnership dedicated to ending violence against children, particularly sexual violence against girls. But working in partnership, Together for Violence has done tremendous work in getting the fight to end violence against children on the radar of global policymakers and national policymakers in a number of countries. And that it's just a name that we all know and work that we're all familiar with. So a huge kudos to them. Prior to joining Together for Girls, Rebecca worked on gender-based violence and child protection programs for a decade in places including South Sudan, Thailand, and here in the United States, where she was it here in the United States where you were a volunteer hospital advocate for sexual assault and domestic violence survivors? So that is how this passion of Rebecca started. She holds an MPH from Columbia University and a bachelor's in community health from Brown. And with no further ado, I'll turn it over to you, Rebecca. Thank you.
Thank you. So thank you, Mark, and to CPC Network for organizing this meeting. To everyone here, welcome. So I'm very excited to be moderating this session on the groundbreaking research being done on violence in childhood by everyone here. And so to talk a little bit more about Together for Girls, the partnership works across 3 pillars to end violence against children. So the first pillar is promoting research, primarily through the national level violence against children surveys, which look, as many of you know, at violence in childhood among 13 to 24-year-olds, for girls and boys, and looking at emotional, physical, and sexual violence. And those are used to catalyze multi-sectoral program and policy response among government and community-based actors. And then we work to raise awareness and advocate around violence against children in general. So we are a learning partnership and work very hard to promote evidence-based actions and using research to promote prevention and response of violence against children. When I started doing this work about 15 years ago now, or when I think about sitting in one of these seats as a student here 7 years ago, the science around violence prevention and response was very new. And where we've come in the last 30 or 10 or even 5 years is amazing. The work has expanded exponentially, and what we know has expanded exponentially as well. So I'm very excited to introduce all of the panelists and projects that are going on to expand our understanding. I'll start with Alina Potts, who will be presenting on the multi-country study of drivers of violence. She was introduced earlier as the Research and Evaluation Specialist with the UNICEF Office of Research in Italy. And as Mark mentioned, she has over 10 years experience in gender-based violence research and programming, including working on the emergency response team with IRC. I'm also excited to be moderating a panel with her because we sat together as students in this room as well. So it's nice to come back this way. So Alina, I'll hand it over to you. And I am going to be quietly keeping time in this corner where maybe no one can see me.
Okay, thanks, Rebecca. Thanks, everybody. You're seeing a lot of me this morning, so I hope that's okay. So I'm going to talk about the multi-country study on the drivers of violence affecting children. And I work with UNICEF's research center in Florence, Italy, which is very nice. And yeah, so I'll just dive right in. So the central question that this study is addressing, and I should say the person leading the study is Catherine Maternowska, who I have the privilege of working for, so I'm hoping to do justice to the work through this presentation. But the question that's driving it is, what drives violence affecting children and what can we do about it? So I'll say briefly that through Catherine's work in a number of countries, mostly in East and Southern Africa, her work around the violence against children surveys, working with UNICEF to help governments to figure out, well, what do we do with the results of these surveys? And so there was a lot of, as Anna Maria said earlier, fear around the numbers that came out of those surveys, right? It's quite intimidating. Violence is a complicated and scary field anyway. And so, and there's a big desire not to do any harm, right? So sometimes that can actually prevent action when people aren't sure what are the most appropriate actions to take. And so this question kept coming up again and again from ministries that she was working with. And the study is really designed to work with national actors. It's very, very contextualized. It's a multi-country study. We may or may not find things that we can say about the whole world from these 4 countries. So I think reflects a lot of the values and principles that we heard in the first panel. There are 3 stages to the study. I'm going to talk today about stage 1, which we're just coming to an end now. And that's really grounding the program. So with each country, a steering committee was set up with a lead ministry, with the UNICEF country office, and then also with national universities, with child protection researchers in that country, with practitioners. And so stage 1 is really looking at what do we already know. So a lot of times people say, we don't have any data. There's no data. We don't know anything about what's going on with violence affecting children. Actually, there's a lot of data and information, and particularly if you move beyond English and beyond what's been published in global journals, there's really a rich amount of information there, including not only nationally representative surveys, which each of these countries had and we were able to do secondary analysis with, but doing a literature review that included PhD theses, master's theses, ethnographic work, and really led by people that would go to different repositories of information in the countries, would visit universities, would sit in libraries where you could not remove the book, where you read it in Vietnamese. And so doing this work, it took a tremendous amount of time. I think initially Catherine thought it was going to take 1 year. It's taken about 2.5. So my advice is double the amount of time you think you need to do this, and then maybe add 6 months to that. But it really has been it's a study where the process is as important as the products. And I think we've seen that. I'll give a few examples later in terms of some of the movement that we've already seen within the countries that has been informed. And as Santi said, we wouldn't want to take full attribution, but we can see when the research and the process is informing the discussion. So that's been very nice. I won't talk too much because of the limited time this morning about stages 2 or 3. You can see here the ideas for those. I'll say a very tiny bit at the end. So Mark referenced in his presentation the work of Yuri Bronfenbrenner, the socio-ecological model, which I think many of you are familiar with. We've used this as one of our 2 guiding frameworks in the study. So really to think about when violence happens and when we think about drivers, at what level are those drivers acting at? And how can we get at the dynamics between these different levels? And so in each country, we've had workshops with the lead actors where we've been actually, just using flip chart and Post-its, kind of putting on this model where we think drivers lie and having discussion between different countries about that. I should say the 4 main countries we're working with are Zimbabwe, Vietnam, Peru, and Italy. So you can see we have a very vast selection there, different regions of the world, different income levels, but a lot of learning and sharing that's happened between those countries. And so I don't want to put too much emphasis on how things are phrased here or exactly where we put them in the model, because this is really just kind of our a synthesis of what's come up in a lot of the discussions. It's not meant to be definitive, but we're working towards a number of products that will go into more detail about this. So if it interests you, if it hopefully can be of use, there's a lot that is starting to come out and will come out about it. But I do want to take a little bit of time to talk about power relations, because I think when we look at violence and when we look not only at what we are studying, but at how we're researching it and how the practice is being done, power relations are extremely important. So not only aware of what power we might hold or bring as researchers, as institutions, as government, but also how these play out in households and communities. So this slide has a lot of animation. A number of studies have shown and have focused, particularly studies in Africa and the Americas, on women frequently victimized by men. And I want to say that this slide really builds on the work of the WHO Violence Against Women studies and trying to bring some of that into the child protection field more explicitly. We know it is possible, not as probable, but possible for women to be perpetrators of violence against women, and that also studies show that girls are as likely, if not more likely, to be victimized, often, again, by men, but also potentially by boys. And I want to say here that I'm speaking to all forms of violence, physical, sexual, and emotional violence. So boys are not free from violence. They may be victimized by men, by women. Women may also abuse girls, and then we also have peer bullying and victimization. So you can see this is a simplified model, but just to show the dynamics and the power relations. And so one thing that's been very important in the study is to go through a process with each country of thinking about power dynamics, power relationships, not only in that context, but relevant to the type of violence that they're looking at. So this may look very different for sexual violence or specifically for teen dating violence. It may look very different for emotional violence, but all of these dynamics are there. And so we need to understand the multiple relationships and see relationship both is very important to understanding why violence happens, but also very much in how to prevent it. And so this is where they start spinning. And then again, the life cycle approach, which has been referenced this morning. So this timeline comes from a PAHO document, Pan American Health Organization document. It caught our attention in that you can see it's acknowledging that boys tend to enter adolescence a bit later than girls. So we use this again, not to be overly prescriptive, but to help engender a conversation in each country around what makes the most sense when we're looking at boys and girls and different types of violence and thinking about when they might happen and also when prevention interventions may be best targeted. That should not necessarily be a monolithic process, right? It might look very different for 10 to 12-year-old girls than it does for 10 to 12-year-old boys. It might be very important to recognize the processes that are happening in each country. And just to note, when we had a discussion with some of the leading experts around whether we could come up with a, let's say, be-all, end-all age, gender timeline, it was a great email discussion, and there are no solid answers around that. So it's super interesting. I have 2 minutes left, so I'm going to say a few more things, and then I'm happy to answer more in questions. But just to say again that we're looking at all types of violence. We're looking specifically not only types, but places, so violence in the home, in schools, and in communities. And we're looking at drivers as triggers that can interact at all levels of the socio-ecological model to create risk and protective factors for violence. And we're working with Young Lives, which is a study run by the University of Oxford following children longitudinally, 5 rounds of data collection from, as you can see here, 2,000 children in 4 countries. Again, I won't speak too much to it in this presentation, but we've already shared some learning around corporal punishment. Soon bullying will come out, and then also we have papers looking at children's trajectories of violence in Ethiopia, India, Peru, and Vietnam. So actually, because it's longitudinal, looking over the life course, both what we're able to do through secondary analysis and through qualitative work. There's been demand for better evidence. So you see the 4 original countries and then 19 countries that have expressed interest and that we're working to support in one way or the other through what we call the research to policy and practice process. And so again, not to read these, I believe that this will be available to you afterwards, and I'm happy to make it available to you. But research uptake and national capacity building, super, super important. Working with statisticians in the National Statistics Office to analyze their violence data in Zimbabwe, not taking the data out of the country. Very important. First author on each publication out of the study is a national author. So again, thinking about power in the way you do your research, I think is very important. And then finally, a little taster of the documents, the very pretty, colorful documents that we've documented the entire stage 1 process online. We have a social norms guide online, and we are working on synthesizing and producing documents that are very pretty, like this one. And these are our next steps. So we'll be mapping and going through an action analysis in each country to focus on a type of violence, to start looking at more in depth for how we can improve prevention interventions based on the evidence from stage 1. So thank you.
Good morning. I don't have a PowerPoint presentation, and might come as a relief to some of you, I hope. I'm also the odd man out in this panel, so I must recognize that. I'm an odd man out also because I'm an economist. I've been working on issues of child rights and women's rights for several decades now, and have been quite active in social policy and talking to policymakers. So my presentation today, or what I'd like to share with you, is as an economist, when you speak to policymakers and want to make the case with finance ministers and the people who seem to be dictating development policy, how do you make the case? Before that, let me say a little bit about this No Violence in Childhood initiative. It's a global learning initiative. As was mentioned, it was established in November 2014 as a collective response by multilateral agencies, NGOs, foundations, thought leaders who are concerned about the global impact of childhood violence and the lack of attention to investment in effective prevention strategies. For all of us, I think this is not something new, but the initiative builds on 3 central premises, which we have gathered from all of you. First, violence is preventable. Second, solid evidence and effective communication are needed to formulate robust policies and build credible programs. And lastly, as we call ourselves a learning initiative, we underscore the fact that learning is central to advancing the field, and we need to exchange knowledge on violence prevention across countries, cultures, and contexts. We are organized in, I'm one of the 2 global co-chairs. We have 3 learning groups looking at 3 settings, one looking at home and families, the other at schools, and third at community and public spaces, fully recognizing that these are not watertight settings, but there's a lot of interconnections between the 2. Each setting is in turn headed by co-chairs. We have Patrick Burton here from No Violence, who co-chairs the learning group on schools. And these learning groups have in turn brought in several experts cutting across disciplines and sectors to synthesize information, look at the evidence, do case studies, and so on and so forth. And where we are today is we are getting in the commission papers, about over 50 of them. We will be compiling all of this and producing a flagship report by the end of the year. And the last feature of this initiative, it's a time-bound initiative. So we started, as I said, in November 2014, and we end in June 2017. So a year from now, we'll release the report early next year, advocate for 6 months, and then we don't exist. Okay. So let me now go on to say a little bit about the approach that we have adopted. There were 2 things, as I've already mentioned, that we heard consistently in all the meetings leading up to the No Violence Initiative. The first is that the field of child protection is highly fragmented. There are many experts cutting across several disciplines, working in silos, looking at different forms of violence, and discussions on child protection have become peripheral and marginal to the main discourse. So the first challenge that was posed to us as a group, which was a very multidisciplinary group, was how do we mainstream this question of violence in childhood into the development dialogue? Second point was that very little is being invested in violence prevention, and therefore, how do we make a strong case to policymakers, finance ministers, and those in charge of national budgets that they should wake up and accept the case for increasing investments in violence prevention? And we thought about this a lot, and then we finally decided that the way we would what was important is how do you situate the discussion on child protection in the larger context of development discourse. And for this, we have adopted the Human Development Framework. Many of you may be familiar with it, which essentially starts by saying that you cannot measure progress in society narrowly in terms of an expansion of incomes, or as economists often focus on, economic growth. Income is only a means, it has an instrumental significance, but income certainly cannot become the ends of development. And following what Professor Amartya Sen has said, the ends of development have to be seen as an enhancement of capabilities or an expansion of freedoms. And higher income or more wealth does not necessarily mean greater freedoms for people. And so that is this line of argument. For instance, I might say that a woman might be married to a very rich landlord in rural India, but that wealth is of no consequence to her if she's not allowed to go out of the house, if she can't pursue higher studies, if she can't work, or if she can't do what she'd like to do. So from this framework of freedoms, what we have done is to say that freedom from fear, if you're using the Human Development Framework, we argue that freedom from fear is as important as freedom from hunger and freedom from want. And fear seriously limits the formation of capabilities in children and robs them of the joys of childhood. And now, therefore, ending violence in freedom is intrinsically, ending violence in childhood, 5 minutes? Yeah, that's fine. Is intrinsically important because it is an affront to dignity, it's a violation of child rights. And also, ending violence has an instrumental importance, and we all know the costs and consequences of violence through the life course of the child, through lifelong adverse effects and intergenerational consequences. So building on the story, and that's what we do, let me make 3 quick comments on evidence, which is what we talked about. One is, yes, there has been an impressive increase in data coming from mixed CDC VAC studies and so on, but they are still very patchy. And in many instances, if you take male lifetime experience of sexual violence, only 4 countries report that data. And so one has to be careful when you extrapolate these limited surveys and studies to the whole of South Asia or whole of India itself. For example, if you look at the number of children 2 to 14 who faced any form of violent discipline at home in the past month, in South Asia, only Afghanistan has done one survey of 11,500 caregivers, and it came up with a 74% figure, which was extrapolated to all of India, which means that there are 223 million children in India and 308 million children in South Asia. And whenever you go to India with these kinds of figures, the policymaker just throws you out of the room saying, we just don't believe these numbers. So we need good data, and the kind of work that you're all doing is essential. The second one is that synthesizing evidence and drawing lessons we find to inform programs and policy is not easy. There are no standard definitions, no standard purpose, age groups differ, boys are left out, methods differ, and formal evaluations, even in the language, English language, which language is a big issue, we find are very, very limited. So they have to generalize with a great deal of caution. But nevertheless, there is reason for being optimistic. We see a reduction in trends of violence. There's greater awareness in society, and there's growing pressure on states to do something about it. So let me end by just flagging 4 brief points, which I think others have also picked up. First is any discussion of violence in childhood must be located in the overall context of children's lives, as they intersect with that of their parents, caregivers, families, neighbors, and communities, and you must look at them across ages and across their genders. Second, we are also finding that the prenatal and the early childhood period of a child's life need very urgent attention, especially because science informs us that the damage during this phase has serious irreversible consequences. Third, violence against children cannot be prevented unless measures are taken to end violence against women, and this has 2 implications. One is the importance of focusing on pre-adolescents and adolescents, and second, to address the more fundamental problems of unequal power relations and patriarchy. And finally, I would say that we must all agree that violence is a complex phenomenon. Take poverty and unemployment, which can cause stress and account for violent acts against the child or the mother. But we also know that not all those who are unemployed beat their wives. And we also know that those who are well employed and in decent jobs do beat their wives. Similarly, not everyone who's poor beats his wife, and wife beating can be found as well in well-off families. So what I'm arguing is that while poverty and unemployment can increase the livelihood of violent behavior, these deprivations need to be examined against the backdrop of a whole set of other factors, including inequalities, discrimination, systematic denial of opportunities, social norms, and gender relations. To conclude, therefore, we need to be wary of being very simplistic, coming up with technical solutions, and making a case that, yes, we can end poverty by doing A, B, C in 4, 5, 6 years. We need a much deeper understanding of the cultures and contexts if we want to find sustainable solutions to prevent violence in childhood. Thank you very much.
Thank you so much, Dr. Kumar. Speaking next is George Aluzimbi. He is an epidemiologist at the Centers for Disease Control in Uganda. He has 14 years of experience in research and community work with vulnerable children and adolescents, focused on HIV work. And he is also the co-chair of the Orphans and Vulnerable Children U.S. Government Interagency Working Group for Uganda. He will be speaking to us today about the Violence Against Children survey that was recently completed in Uganda, and we're very privileged to have him here. Thank you, George.
Okay, thank you very much. I think my colleagues here have talked a lot about violence, but I'm going to contextualize what they discussed on the, give it a Ugandan perspective. So as we talk right now, we have the data, but the most important thing, as my colleagues have said, is how to use this data. You can have all the data in the world, but are you really using it? Does it remain for just publication papers and is not used to improve the life of the children? That's a big question that most of you should go back with whatever we are presenting. So basically, our goals for VAX, for violence against children, is to look at the prevalence of sexual, physical, and emotional violence against children. This also includes vulnerable population of children in Uganda. We also want to look at the factors that protect some children from violence, and also factors that put these other children to higher risk of violence. We also need to know the importance of the different forms of violence in terms of children, and finally to see the utilization of the knowledge got and the experiences in terms of the violence and barriers for accessing the services. The other objective major goal for this violence against children survey is data use. We want to know whether the information we are getting from the study is going to be used to respond to and also to prevent violence against children. We also want to build capacity, because it's not about just knowing how to collect data, but are we having country ownership? Are we building capacity to have researchers, to have people who can do studies and ensure that even if we leave the country, CDC leaves, or UNICEF one time closes shop, will the Ugandan government have capacity to do similar research, or the universities within Uganda? So far, the first stage of the study was orientation, which was done some time back. The process started in 2013, a long process of negotiation and trying to have country ownership, which my colleagues from Africa can tell you how difficult it is to convince government to be part of the process. Stage 2, we did a piloting of the test, of the instruments, and Also involved partners, ensuring that we have a strong multi-sectoral task force that will take over the project from implementation up to the time of real programming. So the third stage was study implementation, which was done around September last year, ended in October. And then we are now in the fourth stage. I think this, to me, this is a very important stage. And this is where we are doing a data analysis, report writing, dissemination, and then finally, policy influence, because that's a major thing, policy influence. And that's where we need most of you to actually come up and support the country, Uganda. So our survey strategy was first to ensure that there were two survey strategies. One, data collection took place immediately after an end of school break. In this process, we ensured that students in boarding schools were not involved. Interviewers conducted interviews on weekends and before and after during the school week. We also avoided conducting interviews during the holiday breaks because most children tend to visit their relatives during holidays. The second strategy was to ensure that the instruments are adaptable to the country context. So good enough, most of these questionnaire had already undergone cognitive testing, and they had been refined in other countries. So we didn't have a lot of work to do in that case. Well, what was the criteria for selecting? We focused on males and females between the age of 13 to 24 years. We ensured that there was informed consent to participate in the project. For children between 13 and 17, we had to ensure there was parental consent and then the children assent. Emancipated minors, as usual, between 15 to 17, had to do their own consent. What was the rationale of picking 13 to 24 years in VAX? You may know very well that these are children who are old enough to read the consent probably and understand the survey. The other issue was to also ensure that these children are young enough to remember what happened to them when they were young. You know very well when you're above 24, some of the things that happened to you at childhood, you might have forgotten. Being a retrospective kind of study, you need people who can remember what happened. The participation criteria was we needed people who could speak an approved survey design language. And then we needed also individuals who are physically and mentally capable of participating. What is our status now? Remember, we started in 2013. We ensured that the agencies were given clear roles and responsibilities. The protocol questionnaire budgets and MOU data sharing agreement were done, and this was a participatory process where each stakeholder was supposed to review the documents and agree on the language and everything. This was part of the process of country ownership. We were lucky to get support from funding, more funding support from the DREAMS. I don't know whether you've heard of the DREAMS. It's a big global initiative. So we got some funding, and we also specifically the funding was to oversample 4 clusters where we have the girls who have probably high HIV incidence. And then we also got an extra 200,000 from UNICEF to go for the boys in the same clusters, because for DREAMS, they were only supporting girls. So UNICEF put in money to support boys in the same clusters. Remember, even without regional analysis for these VACs, we still have enough population data nationally to get to get to come up with something which has enough power for generalization. Uganda is the first country to actually power its study to regionally. There are 4 regions that were looked at. Most of the other VACs were more national. Sorry, I have 2 minutes. So Uganda was the first country to go down to regions. And also to involve the dreams, because for the first time, we'll have data in regions where dream is going to be focused. So currently, as we talk, I left my team working on data weighting and analysis with the Uganda Bureau of Statistics, which is our statistical body. My colleague just talked of the importance of involving the statistical bodies of countries. Well, most researches are done by us. We go do research and we go away with our data. So we want to ensure that data remains in Uganda. We intend to have data writing workshop, which will involve partners and other interested parties in manuscript writing and publication. All these activities are going to be between June and July, between this month and next month. In August, we anticipate by August this year, we will have a data to action workshop, which it's actually the exciting period to me as a researcher. I think that's when we will want to see how we shall transform this information to real programming. And we need your support in that to come in and see how we can do better and share our your experiences. One thing I've not put in the slide, but is something of interest to me, and I think most of you, is that after we've done the violence against children survey and we implement the programs, we need to think of doing impact evaluations. When do we think we can do the next VACs? That's the question I'll leave you to think about. Thank you very much.
Thank you very much, George. So finally, I'd like to introduce Mendy Marsh and Beth Rubenstein. Mendy Marsh is the specialist on GBV in emergencies at UNICEF based in New York, where, I'm away from the mic again, I apologize. Always learning. Where she works at a global level to address gender-based violence in conflict and disaster-affected countries in Asia, Africa, and the Middle East. She's worked for nearly 20 years on gender-based violence and violence against children, reproductive health, and HIV/AIDS, and currently works on gender-based violence, capacity, and research across a host of sectors and issues. Beth Rubenstein is the Senior Research Associate with CPC Learning Network, based here in New York City. And she's worked for over a decade in health and human rights, prevention of international child trafficking, health systems equity, and activism on HIV therapy access. And they will be presenting on transforming households, reducing incidents of violence in emergencies, or the Thrive Initiative. Thank you very much.
Thanks. So I'm really happy to get to present this with Beth. We're going to tag team a little bit. This is a project that's been kind of a long time in the works, and we're excited that it's finally getting off the ground. So we're going to go over the little bit of background around this project. Beth is going to talk about the reviews that we're working on, and then I'll go over phase 2, the formative work, and phase 3, what we're thinking about in terms of implementation and evaluation. So why Thrive? I think there's, as Dr. Kumar has said, there's emerging or better recognition of how we can address violence against children without addressing violence against women and vice versa. There's a more intensified global commitment to addressing violence against women and violence against children, in particular for violence against women in emergencies through the call to action. We've, over time in the humanitarian world, have focused more on violence that was happening outside of the home, right? We've been doing things that, all work that's necessary, working on preventing the use of sexual violence, for example, by armed actors, but we haven't focused in on the violence in the home in the way that we know that we should. The development field, I think, has made a little bit more progress than we have in emergencies, and so we feel like we need to catch up in relation to how violence against women and violence against children gets exacerbated in the home setting in an emergency. We also know that those sectors of child protection and gender-based violence in the humanitarian realm have often been separated or fragmented, so we think this is also an opportunity to bring both sectors together so that we can kind of leverage the good work that's happening in both and see how we can capitalize on linking the work on addressing violence against women with working on violence against children. So the overarching aims of Thrive are really to enhance the capacity of the humanitarian community to measure and prevent household violence in emergency settings. So thinking about how children are observing their mothers being abused in the home, how they're direct victims of violence through child sexual abuse or some other form of violence, and thinking about how those two really intersect and how that can be exacerbated in the emergencies so that we can work with the humanitarian community to build our collective capacity to tackle all of these different forms of violence. And also, again, to encourage this collaboration between these two sectors. So specific objectives of Thrive are really to build the evidence base on risk factors and drivers of household violence and emergencies. We want to develop a grounded theory of change, and then identify the interventions that we think really can work to reduce household violence in that emergency situation, and then devise a measurement approach to actually evaluate the intervention. So how is this all working through Thrive? So it's a collaboration between the CPC network and Columbia and UNICEF. So CPC is the technical lead for the research that we're going to carry out, and UNICEF is the operational lead for coordination and implementation of the project. And we have OFDA colleagues in the room, with huge thanks to OFDA for supporting the phase 1 and phase 2 of this project. So I'm going to hand it over to Beth now to go over the reviews.
Thanks, Mendy. So as Mendy explained, the emphasis of phase 1 is to review the existing literature on violence against women and violence against children in the household so that we're able to build on existing evidence and we're not reinventing the wheel. So we're in the process of conducting 2 reviews, and we should have results by the fall. The first review is a formal systematic review that's going to follow the official PRISMA standards as closely as possible, and those are a consensus statement around how to conduct a systematic review of academic literature. The idea with the first review, the risk factors review, is to identify the factors that are driving household violence at different levels, from the national policy all the way down to the individual characteristics and behaviors, and of course everything in between. So back to that ecological model that Alina showed on her slide. And the second review is what we're calling a landscaping review. The focus of the landscaping review is to identify programs and interventions, and we've purposely structured this review to be more inclusive and more flexible. And that way we capture as much information as possible, and we're not kind of beholden by as many strict standards as with a PRISMA review. And there are advantages and disadvantages to both approaches, of course. And the findings from both reviews are going to be used together to inform our theory of change, which we'll then use to design our intervention. And Mendy will get more into how this information will be used in subsequent phases. So for the risk factors review, we started by coming to consensus on a specific research protocol to spell out our basic inclusion criteria. And there are some other people in the room that were involved in that process. Our outcome of interest is physical, sexual, or emotional violence between 2 or more members of the same household. And by members of the same household, we mean nuclear family and or intimate partners, because in many cases, of course, the study is not going to specify whether or not people are in the same household. But for nuclear family members and intimate partners, we will assume they are living together. And our goal is to identify risk and protective factors that are positively or negatively associated with these outcomes of violence. So we're interested in factors at all levels, including policy and community level factors, family factors, individual factors, again, working within that ecological framework. We've restricted our findings to quantitative studies conducted in humanitarian settings and published in peer-reviewed journals between 1998 and 2015. And we also restricted our findings to studies with reported statistical associations. We built our search string with the assistance of a librarian and ran it through 3 different academic databases. So we started with about exactly 2,587 studies, and we expect that we'll retain about 50 studies for final analysis. For the landscaping review, as I mentioned, our goal here was to be less strict and more inclusive. So we therefore aim to identify an exhaustive roster of existing interventions in the field through consultations with gender-based violence practitioners, child protection practitioners and NGOs, and intergovernmental organizations. So we've included gray literature and internal documents, including descriptions of interventions that have not yet been evaluated. We also included studies from low and middle income countries that are not considered humanitarian settings, and the rationale here was to identify promising strategies that may merit more rigorous evaluation in this project in a humanitarian setting. So we've so far identified around 85 interventions, and they range from parenting programs to economic empowerment to community mobilization, and most have not been evaluated. So here is a bit of a schematic explaining how this is all fitting together. To begin, this is the ecological framework that I have referenced, and we are considering risk factors at all of these levels, both with regards to violence against children and violence against women. Most studies tend to look at either risk factors for violence against children or risk factors for violence against women. But in reality, some of these risk factors overlap, and it's this intersection, this middle space, that we're most interested in targeting. Because if we can successfully target interventions at this middle space, we can potentially reduce violence against children and violence against women simultaneously. So with regards to programs and interventions, we want to focus on these intersecting risks. And once we've synthesized the findings from both reviews, we'll then feed this into the more rigorous learning into the development of a theory of change.
All right, so the phase 2 formative work. Right now we're negotiating with different country offices to do the pilots in two countries. So the first one's going to be in Papua New Guinea, and we're quite excited about that. It's not maybe what we consider to be your typical emergency situation, but we're going to be looking at the impact or the effects of El Nino there, and also the rates of violence are significant in PNG. We're also talking about going to either Ethiopia or OPT as an option. We might look at the effects of El Nino on Southern Africa as well. So stay tuned for what that decision will be. So the second phase is really going to be working to identify the local social norms and drivers of household violence so that we can refine the theory of change that Beth mentioned based on the information that we're generating in country through a qualitative approach. Then we'll contextually select the interventions and develop tools to support country partners to adapt those tools and to actually implement those tools. And then we'll be developing and pilot testing a measurement tool and also evaluation design. So phase 3, really quickly, since I'm out of time, is the implementation and evaluation. So we'll actually work on implementing the interventions. The idea would be to, we'll ideally implement the interventions in the 2 pilot countries that we choose for phase 1 and 2. implement the evaluation, and then disseminate the findings, disseminate the outcomes of this and the package so that humanitarian practitioners and policymakers can actually use the materials. And again, to sort of build the capacity to work on violence against women and violence against children in the home in emergency situations. That's it.
Thank you, Mindy and Beth. And I also want to express my admiration for everyone who really kept time. I am amazed by this panel for many reasons. So with that, that was an amazing diversity of research methodologies and experience. And I'd like to turn it over to the audience for questions. I think if we take maybe 3 questions at once, and then we can turn to the panel. And for anyone with questions, if you would start with your name and organization, that would be very helpful. Thanks.
Thank you, everyone. Fantastic presentations. I'm Bill Forbes from World Vision International and the Child Protection Monitoring and Evaluation Reference Group. And I suppose this question is for Dr. Kamar specifically, but really for any panelist. You mentioned about the risk of simplistic solutions and the complexity of poverty and the contextualized reality of poverty, or of violence, sorry. And so I'm wondering about, as we identify learning in these contexts and evidence in these contexts, and begin to define interventions, with the risk of when we begin to globalize this learning, of it being translated into simplistic solutions, which then get exported to different places, like we heard from Burkina, the risk of that. And even with the SDGs and the movement for, solutions to violence being promulgated, with the Partnership to End Violence Against Children and the Inspire Thrives and then Inspire. Can you speak a little bit about how we continue to learn and translate those learnings into generalized solutions and interventions but avoiding the risk of simplifying it and standardizing it in ways which are harmful?
Hi, my name is Hani. I'm with the CPC. So the question is basically in studying the issue of violence, also kind of referencing back to one of the criteria that George, I think, mentioned in his presentation about the inclusion criteria, for example. And you mentioned physically and mentally able to participate. How can we make sure, and also kind of the fact that a lot of the research methods that we use, especially in humanitarian context, are the ones that are, as I think Mark was talking about, usable in a lot of humanitarian contexts, which means that by the nature of it, a lot of it are the simpler kind of approaches, in the sense of, if it's too complicated, then it becomes unusable in a lot of humanitarian contexts. So the question is, how do we make sure, given all of those limitations that we have, that the most invisible get also included in the issue of violence? And we know a lot of the time they are the ones that are target of a lot of the violence, but we don't know how and to what scale. So what can we do in doing the research that we are doing to make sure they are also included?
Can you hear me? Yeah. This is Anita from Child Fund International. Thank you to the presenters. I also wanted to follow up on George's presentation on the violence against children study in Uganda. I was curious why another criteria was that children in boarding schools were not eligible. And I was curious because Uganda is full of boarding schools, so why was that excluded?
So we'll take one more and then pause so that everyone can answer.
Quick question. A couple of speakers mentioned about keeping data in the country, and then I think another speaker mentioned that a push toward data sharing. So I was wondering if speakers could comment on that, what's the reason for keeping data within the country, and whether we will be seeing kind of more data sharing.
Okay. Do people want to begin to respond? We can go down the line however you want.
Okay. Let me start. Thank you for that question on the simplicity of solutions and also the need to innovate, experiment, learn from the field, and inform policy. I think that's the real challenge. In many ways, when I look at it, take poverty eradication or reduction. It's as complex a phenomenon as violence reduction is. And so there are lots of lessons that one can learn from efforts at poverty reduction, which can also be applied to other fields. So in that sense, when I say this, I mean that when you look at experiences of poverty reduction where they have succeeded and where they have not, you will find that it is not just one intervention that does it. Somebody says education will get you all the employment and empowerment. You find that it has to be education, it has to be health. In fact, you're addressing the more fundamental problem of poverty and inequality of opportunities around a whole set of political opportunities, civil, social opportunities, economic opportunities, cultural opportunities of participation, and so on. So I think the lesson you get there is you need multi-sectoral, integrated approaches to poverty reduction. And I think the similar approach is what you need towards poverty reduction and violence in childhood, that it cannot be one solution. You can't go into schools and say bullying is the biggest problem, so let us address the issue of bullying and you will sort it out. Because you find that what happens in the school is really, it's a microcosm of what happens in the household and what happens in the community. And therefore, just a simple program that addresses bullying in schools is not the solution. And in fact, that's what's coming out of our learning groups as well, that you really have to go beyond that and look at the entire culture of the school. And you talk about, it's the old case, in India we said if you get full enrollment, you've achieved your goals. That was the indicator. Then you said from enrollment to attendance. Then it went from attendance to participation, then from participation to learning. Every time you discover. So we are at a very elementary stage where we say if you do something, it'll happen. But we need a much more integrated view of violence reduction, saying, if you want to end violence in schools, you have to look at it more holistically. You have to engage the teachers, you have to engage the communities, you have to engage educationists and so on much more comprehensively. And I say this also because as people in the field, when we go to talk to policymakers, if you reduce yourself to bullying, then the education secretary may not have so much interest in talking to you. But if you tell him that, listen, we're talking about reforming an education system with a small intervention where your returns on what you're already your existing returns are going to increase manifold, then he will talk to you. So we are trying to say that link it to the broader social context and policy. Alcohol is another very good example. Yes, we all need to ensure that people don't drink and show aggressive behavior. But that itself cannot become the main issue. Because if you look at wife beating and in the domestic violence literature, there are people who drink who don't beat their wives, people who don't drink who beat their wives. So it's very difficult what is it that you want to attribute to alcohol per se? The point is you have to look at alcohol consumption in the overall context of patriarchy and unequal power relations. And so if you take the conversation not about how to curb alcohol drinking, but also link it to saying, yes, these are effective ways of curbing alcohol drinking, but the dialogue and conversation has to extend much beyond that to say, what is this about gender equality and respect and dignity that we are overlooking completely? And how do I build a more equal society where both men and women are treated equally with equal respect? I think that fundamental goal we should not lose in identifying. And I think that leap is what we have been able to do in the poverty sector, that don't narrow it down to interventions, but look at broadly universal health coverage, social determinants of health, and so on and so forth. We take the conversation to a level which engages many more actors in society.
To say a few things. So I appreciate all the questions. And the first question about simplistic solutions, I think it's a great question. It's something that, it's very difficult to get kind of that package and know how to apply it without having the skills to be able to contextualize it. And so I think we really need to think about who's able to have the conversations needed to implement whether it's research or interventions, right? So that's why the first panel on the discussion of national research capacity, I think, is extremely important. So that, often researchers and practitioners, I've been both, and often they talk across each other, or they don't talk to each other, or they just wait for the other one to go away, I think, and think, they don't understand. Like, they don't understand what it's really like to implement a program. I've definitely thought that about researchers. Well, they just go by their gut and they're not actually interested in what's actually happening. I've definitely thought that about programmers. So to try to really bridge that gap, I think is extremely important, because a solution will be simplistic if everybody who's invested in making the change happen doesn't have the tools to have the conversation with each other or the interest to have the conversation with each other. And so I think that everyone here is probably contributing to making that possible in one way or the other, and that is really a priority. And I think about the, great question from Hani about the invisibility of certain populations. For me, my 2 cents for this morning would be to really look at, again, the importance of both quantitative and qualitative methods, and not see qualitative as an add-on or something extra or something that you do a few focus groups to make somebody happy. But really to look at, like, how do different methods get at different populations? A nationally representative survey, which is already tremendously expensive for a government to do, will never be able to speak to hidden populations, or is it even safe to target them? Are you bringing into the sphere people that are actually safer if you just leave them somewhat alone? So, who are the best actors to look at this, and what are the best methods? There are many methods, there are many actors out there. So it's not that each can speak to all, and I'm not saying that there might not be a case where a nationally representative survey could do that. But just to really, again, for all of us to be able to have the conversations about those things would be really helpful, because they're really important conversations. And a country could, I remember working in Central African Republic and a study that was done on people living with disabilities, children with disabilities, and violence, and it was astounding. So you could be missing a very important part of the population there, but to be able to reach them with the right process, the right methods, and I think above all to be participatory, so to have conversations with and not about, and that's probably really the best way to understand how can we make sure we're doing work that serves everyone, but also that's done with everyone as much as possible. I think finally the data in country versus data sharing, so probably similarly to the first 2 questions. This again is about who's in the end, who's making the decisions and who's using the data. Because Lori Heisey, who's done tremendous work in the field of violence against women, talks about a process of discovery, facilitating a process of discovery that is important to have people, whether they are ministry, ministers and their technical staff, whether it's researchers, whether it's practitioners, but to have them go through that process of discovery together and look at what is the problem and what do we think we can do about it? And so that cannot happen in New York and DC and London all the time, right? It needs to happen in the various sectors. And also to think about, even within a country, violence work often sits within the weakest ministries, right? The ones that have the least finances, they have the least say in these discussions, and do their best with very few resources to try to push the agenda forward. So how can we facilitate that process of discovery, bringing in people from the Ministry of Finance, bringing in stakeholders that need to be part of this, and actually going through looking at the data together has been one way that we found to be pretty effective. And I have to say, for all 4 countries, they've all committed money ranging from $50,000 to $200,000 in their budgets for violence prevention work for the second stage of the study. So, so far that's an indication, at least, that process of discovery has been somewhat effective in engendering some steps forward.
Sorry, I'm so tall I have to bend. The question about why children in boarding schools were not included. Remember this survey, it's a very important question, and we went round and round on it in Uganda. So we had even to look at the data, the UDS and all the data that is available in Uganda on boarding, which is very limited. We worked with Ministry of Education to look at how that could affect the final outcome. However, with findings were that one, it could not affect the final outcome that much, and then 2, being a household-based survey, you need to get children at home So being in boarding alone makes it go against the protocol. So we focused on children who are at home at that particular time of the survey because of that.
Yeah, thanks so much for all the questions. I think that you all raised so many interesting points. With regards to, the first question about simplifying, I think that's, it's something that we all struggle with every day. I think the question is often posed as, does this intervention work or does it not work? And it's, posed in a binary way, but when you actually kind of get into the literature, that's not usually the conclusions that, that comes out of studies. It's how much, how does it work? Who does it work for? Where did it work? And I think, we all need to do a better, there we go. We all need to do a better job of trying to think about those subtleties and using, it doesn't mean that the literature or, the existing learning doesn't have value, but it needs to be used broadly to inform something, and then we do need to be in a constant state of reevaluating and learning as we go along, because there isn't a simple answer about what works and what doesn't work. So we can use what's been done in other places and say, oh, this is a good idea to try a certain approach, but once we've selected that, we don't have a guarantee that it's going to work or it's not going to work, and we need to. That's why there's ongoing monitoring and evaluation that we need to participate in because every context, even within countries, there's different regions, there's different subpopulations. And then in terms, I think that speaks to Hani's question about making sure that we are as inclusive as possible, and it is a limitation of household surveys that they miss children and people that are living outside of households. We've been doing some work in Cambodia that I'm going to present on tomorrow about trying to get a better sense of the scope of the population that is outside of households. And there's talk now in Cambodia where we did this initial work of expanding the national census, so that we can have a sampling frame that it goes beyond households. But the reality is that right now no low and middle income countries that we know of include institutions in their national census. So it is very, very difficult to take a representative sample from institutions in the way that you're able to do that with households, which is why we default to the household surveys. But I think there is interest and dialogue happening now about expanding beyond households. And yeah, I guess the last question about data ownership, I think, ultimately, I think it is the ideal is to have the data, have it be owned by the country, but that doesn't mean that the findings cannot be shared. So I think the data ownership is not quite the same as dissemination of findings, and we want the dissemination to be as broad as possible, but driven by local ownership.
I don't really. I can't. Okay. Yeah. I don't have a lot to add. I agree with what everyone has said. I just wanted to flag a couple of things that Beth has said and Alina as well. I think this Thrive project has huge potential to allow us to be quite creative in the way that we collect information and sort of try to get at the most invisible sort of children and women who we may not be able to access in typical ways. I also think the humanitarian field, by nature of having to do things faster and often we're leading the charge in some ways on creativity around research and also around interventions. And so I think we want Thrive to actually really be applicable and helpful to the humanitarian world, but I think it will, if we do it well and do it right, that it will have a lot to we'll have a lot to share with the development field in terms of how we approach this issue. And I think the ownership point too is that's one of the reasons why we're a little bit we're struggling on finding that second country, right? Because we want to make sure that we identify a second pilot country that is going to be able to really embrace that this is going to we're going to uncover some things that are not pretty, right? And that we want that learning to facilitate global learning, but we also want it to facilitate very specific contextual learning in that country, right? To really build that grounded theory of change in a way that we can document that process and then help people apply it based on those lessons in other countries, and to really be able to do that contextualization that is really required to address this kind of violence.
Thanks for that, everyone. And I just want to add on that having national and local ownership of these processes is also not exclusive from public availability. And in fact, many of the violence against children data sets are now available for public use, just putting a little plug in. And, for example, have been used in the Drivers of Violence study, I believe, to do some of the secondary analysis, so that there's work to balance increasing ownership at a national level and availability of data. I believe we have time for a few more questions. And I see Mark's hand up. Someone can get him the mic.
How about now? All right. My question is actually for you, and I don't know if you spoke about this, Rebecca. I really appreciated hearing that qualitative's not an add-on, that it's integral to quantitative analyses. And I think another theme that we've heard throughout the day already is contextualization matters. And I know that in the upcoming Violence Against Children survey in Colombia, you have invested quite significantly in ensuring that there is a deep contextualization process. So maybe if you could tell us what your thinking was behind that and how you plan on going about that. Other questions?
I feel a little weird saying I have a question, but I have a question for the panel. I guess just because I was talked to last. So I was thinking about all of these research projects linked to drawing the fields of gender-based violence and violence against children closer together, and the increasing understandings that we have in research and practice around the very complex interlinkages between what's driving violence and the results and the causation, and also how programs interlink in prevention and response. And I was also struck by something you said in the presentation on no violence about one of the challenges being that we don't have standardization of measurement. And so even within violence against children and violence against women measurement, there may be very different indicators or age groups, and then when you try to bring them together, you also sometimes have some difficulty knowing what you measured. I'm interested in everybody's observations and thoughts on looking at the national level and research that you're doing. What are the successes and challenges you found on bringing these fields of research together, on alignment of indicators, and where you feel like we can go forward in terms of drawing research in these fields together and some level of standardization, or maybe where you feel like they should not align, and how we can keep that balance. I saw one more question. So maybe I'll should I answer the question to me? And then we'll go this way, and then we'll wrap up. I see we're low on time. So for Colombia, it's actually not a full violence against children survey that's going forward at this point. As part of the decision-making process, the government requested doing a small pilot. And so Together for Girls with UNICEF and CDC and partnered with the Columbia Group for Children in Adversity are working on doing some national level research. I believe there's a review going on mapping what data already exists. And then we'll be working with the Columbia Group for Children in Adversity in the coming months to look at piloting and cognitively testing specific modules in the Latin American context, and specifically in the Colombian context. And so the thinking behind that was, I think, for a lot of reasons. Partially, this is the first time that a violence against children survey has been conducted in Latin America. There are particular forms of violence that will really be highlighted probably as the partnership enters that region, particularly maybe community violence that haven't been highlighted as much through the surveys in the past. And there's also other areas of review and growth within the survey we'll be looking at. So thinking about how you tailor questions to context and how children interpret them. Another reason for doing that is to ensure that the questions are rooted in the priorities and needs and understandings of children, so that the science on how violence is perceived and understood keeps growing. And it will be a tool for the government and civil society to make decisions about what research on violence against children would look like in the country, and decide what the best way to move forward is. And that iterative process can be really important, particularly entering settings where Colombia is a country that there's probably a lot more focus on violence and understanding of it as a major issue than there has been in some settings in the past. The surveys are often, the data is great, but they're really important as catalysts for action. And countries go into them with the intention of these long-term responses and building momentum and building capacity and champions and ownership around them. And so as these surveys grow, and also as violence takes on this greater profile, having different methods for building multi-sectoral ownership and deciding how a prevention and response initiative would be shaped may have a full survey, may not. And so I think just having that flexibility around how we see multi-sectoral models growing is also one of the things that helped us make that, or helps Colombia make that decision, but also part of a global understanding of what violence research and response look like.
So I'll be really quick. I mean, since we haven't started our Thrive work in the sense of the formative field work, I can't say a lot. Beth will always be able to say more on that, but I think we're moving in the right direction. The great interest that our offices and partners have had in this project, I think, demonstrates that everyone knows that we need to move in this direction, where we're really trying to look at the complex intersections between violence against women and violence against children, in particular in emergencies. I think one of the things that has kept some of our offices from being able to be part of the pilot process now is that capacity to look at can we really look at how the drivers change in the emergency situation as one, but also just they're not having full confidence that we're going to be able to implement the intervention from a multi-sectoral perspective and to really address violence against women and violence against children at the same time. Because I think that because our sectors, in a sense, have been so separate, we have a lot of initiatives that are just training frontline service responders to care for children or just for women, right? We're not leveraging our resources to really build multi-sectoral service capacity to meet the needs of both children and women, noting that the needs are different and the way that you would intervene and you would work on the context of patriarchy and disempowerment and what that means for a woman or a girl who is sexually assaulted, for example, or abused by their partner is different from a child's sexual abuse. And so I think we have to kind of work on that capacity to get ready for the response while we're continuing to look at the drivers themselves.
Yeah, I think Mendy said it very well, and we haven't really gotten this project started, but I think one thing to remember as we embark on the project is just to take time to set up the processes, to build partnerships, to build trust, to build local ownership at this stage that we're embarking on now, because that will be the foundation of everything to come.
Yeah, in addition, in Uganda, I think there's a process in place to involve all the sectors, and the ministry in charge of women and children, that is the Ministry of Gender, Labor and Social Development, is taking a lead to bring all the sectors, all the government sectors and private, multilateral, bilateral organizations to come together so that they have some kind of a way forward to put this. The other thing is that in Uganda, we are trying to look at violence against children as a public health problem. So right now we have Ministry of Health has been convinced to include the violence module in the Uganda population-based HIV impact evaluation, which is soon going to be implemented. So we are going to see some kind of integration of violence among women and children in HIV, and probably we could really do a further analysis because this national survey is going to collect biomarkers, so we'll be able to really see how these different types of violence are related to different biomarkers, and maybe very important for us, maybe as programmers and researchers.
Yeah, so for the question about violence against women and violence against children, there's 2 countries that would be interesting to talk to or look at. So both South Africa and Tanzania are doing a lot of work at the national level. Tanzania just holding a workshop to integrate their violence against women and violence against children national action plans, in South Africa doing a lot of research and work on this as well. So those would be great places to learn from. And then I think also something that in the Thrive project we're looking at for the 3rd stage, grounding and developing these theories of change. This is something also building on the methodology of the multi-country study, where we will be holding at the end of this year an Understanding Pathways workshop, again to look at developing theories of change from what's come out of stage 1. So I think this is a real opportunity for the violence against women and children communities, or whichever term you would use to talk about them, but those interested in both of those populations, to look at where these theories of change intersect and overlap, and look at some of the root causes, and really see that we're talking about power, I think, in many ways at the end of the day, whether it's related to gender or age. And so there's a lot of ways that we could come together from that grounded theoretical perspective to then understand in our particular research area or intervention area, what does that mean? How can we contribute to a bigger overall picture in which everyone is hopefully leading a more peaceful life? So that's all I'll say for now. Yeah.
1 minute. Okay, this is my final 1 minute. No, she also has to. No, I just want to underscore the significance of the title we chose, which is called No Violence in Childhood. And we deliberately called it Violence in Childhood because we did not want to call it violence against children or violence against boys and girls also. Because we were very conscious of the fact that the experience of childhood conditioned by what happens in domestic violence in the household is so significant. And I'm delighted to find that all the studies are now picking up violence in childhood. I also want to say that in the discussions that we have had, even boys and girls is becoming a problem because issues of sexual orientation and gender identity are coming up as you grow older in schools as a major reason for bullying and for being ostracized and for being traumatized. So we have to also open up our methods of investigation to see how, without being very aggressive, we, in a very, very nuanced way, in a very child-friendly way, we also pick up these dimensions of violence that we normally don't pick up in traditional surveys. So I'll stop there just to end by saying that our flagship report will come out in January 2017, and we look forward to sharing the findings with you and hope that you'll all champion the cause of ending violence in childhood. Thank you.
Thank you. So we're exactly on time. And I also I want to say I forgot to mention when I was answering the question about Columbia that the University of Los Angeles is here, who will also be working on the violence against children work as well. So that's very exciting for me to be in the same room as all these future partners. I'm wondering if anybody has like a one sentence, one thought take home that they want to share as we wrap this panel up on research and innovations on violence against children, or if you feel you've already shared it. Okay. Well, thank you, everybody. I think I'm going to take the quiet as a no. I think some really amazing themes came out through this. The importance of bringing many partners together from across different sectors and also different platforms, as well as the importance of using a multiplicity of research methodologies. Everyone's work here is very different and going to provide both global learning but also contextualized research. And so the importance of being able to have both local ownership and really nuanced understandings of violence and quantitative and qualitative methodologies, and also being able to put those together, and the importance of action from those, and then use for this global learning platform and building networks between countries that can share what they've learned and be able to adapt. And the importance of bringing understandings of gender and patriarchy together with understandings of child development and violence, and then in measurement being able to disaggregate so that we have a better understanding of where and how violence is happening. I imagine the meeting in 2 years, there'll be results from some of these studies or even sooner, and so it's a very exciting time, and I look forward to that. Thank you to everybody here for your amazing presentations and the questions. I think it might be time for lunch.
It is time for lunch, and thank you, Rebecca, for a great job moderating. And my takeaway from this panel is that 5 years ago, we would have been asking, can we measure violence against children? And now we're talking about how best to do it. And that is a major shift and a really important one. And to refer back to what was said this morning, until we know the scale of things, we can't begin to address them. So I think it's really important, and another round of applause for the people at the cutting edge of measuring this. Amazingly, Lindsay is out of surgery and has texted me to tell me that in her drugged up state, she's watching on the live stream. So, on the count of 3, everybody, hi, Lindsay. 1, 2, 3. Hi, Lindsay. And for those others on the live stream who'd like to send in their questions or thoughts, #CPC 2016.